linked to mental health. When you think of the effects of COVID-19 or long COVID, you think of this. But what about your mental health?
So it's really the neurologic manifestations that we've been able to characterize following SARS-CoV-2 infection that fall under the umbrella of long COVID are much wider in scope than just brain fog that most people talk about.
Studies found that people who had COVID are much more likely to have incidents of depression, anxiety, sleep disorders, opioid use disorders, and other substance abuse disorders. But do vaccines help?
Vaccine reduces the risk, but does not eliminate the risk of these manifestations.
Unvaccinated people who were hospitalized due to COVID were over 15 times more likely to have an incident of depression compared to over 12 times for vaccinated hospitalized people.
You can think of it as when the tsunami hits and the water recedes, or when the earthquake stops, or the earth stops shaking, you're going to be left with the damage.
It is each person's choice, but they need to be aware of the risk when they make that choice. The doctor has another new study on the effect of long COVID on every organ years later. He found the risk of death was no longer present in patients who weren't hospitalized with COVID-19 3 years after infection, but the risk of death remained elevated for those who were hospitalized.